All right, so get ready because we're about to dive into something you might not expect.
Oh,
Weights and measures and timekeeping
interesting.
for CNAs. Yep, we're going deep into the California Community College's Chancellor's Office Nurse Assistant Model Curriculum,
Okay.
specifically Module 7. And let me tell you, there's way more to this than meets the eye.
You're so right. It's easy to think of this stuff as like basic,
Right.
but it's the foundation of everything a CNA does.
Mm.
Like literally everything. Think
Mm.
about it. Every single medication dosage, every assessment of how a patient's doing, even keeping them safe during procedures.
Right.
It all comes down to accurate measurements.
Wow. Okay, I'm already seeing things differently. It's like all those little measuring cups just got a whole lot more serious.
Right.
But I gotta ask, why are we making CNAs deal with both household and metric? Like,
Uh-huh.
can't we just pick one?
Oh, I wish.
What the?
But you see, the U.S., we're all about our ounces and pounds, feet and inches.
Mm-hmm.
Tradition, familiarity. But healthcare, that operates on the metric system. It's the global standard. Plus, conversions are so much easier that way.
So basically, CNAs are like measurement bilinguals.
Pretty much.
That
Yeah.
sounds like a recipe for some serious confusion.
It can be. That's why training is so intense. Got to be fluent in both languages.
Wow.
Grams versus pounds, milliliters versus ounces,
Right.
the whole 9 yards.
Okay, so let's say I'm a CNA and I'm about to weigh a patient. What's the first thing I need to think about? Do I just like plop them on a scale?
No. It's not that simple.
Huh? Okay.
You have to consider the patient's condition and pick the right scale for the job.
Ah, that makes sense.
So for someone who can stand easily, a standard scale is fine. But what if they're in a wheelchair?
Ooh, good
Oh.
point. Can't exactly roll them onto a regular scale.
Exactly. That's where a wheelchair scale comes in. And here's where it gets kind of interesting. You ready for this?
I'm ready.
You actually weigh the empty wheelchair first, then subtract that weight from the total when the patient's in it.
Wow, that's so smart. It's like a little math puzzle to make sure it's accurate.
Exactly.
I'm starting to realize there's a lot more thinking involved in these simple tasks than I thought.
Oh, absolutely.
Huh.
And that's the kind of thinking that helps CNAs give really good, safe care.
Right.
They're not just taking measurements, they're using them to make decisions about patient care.
So it's not just memorizing conversions and procedures, it's about understanding why we do it all.
Yes.
How it connects to the bigger picture of a patient's well-being.
Exactly. Speaking of connections, how about we talk about how these measurements directly impact something as crucial as medication dosages?
Oh, yeah, that makes sense. I mean, the wrong dose could be, well, really bad.
Exactly. That's why accuracy is so important. Say a doctor prescribes a medication based on a patient's weight in kilograms, right?
Okay.
But the CNA records it in pounds.
Uh-oh.
That could lead to a dosage error.
Wow, I never thought about it that way. So it's not just getting the numbers right.
No,
It's about understanding what those numbers actually mean in real life.
you got it. And that brings us to another important part of a CNA's job, tracking a patient's progress over time.
Right. Like keeping tabs on their weight or fluid intake to see if they're getting better or if something's off.
Exactly. Let's say a patient has a condition that's making them retain fluid. A CNA can accurately measure what's going in, what's coming out,
Right.
and give valuable data to the healthcare team so they can adjust the treatment plan.
It's like they're putting together a puzzle
Yes,
where each measurement is a clue about the patient's health.
exactly. And that's why it's so important for CNAs to not just know the steps, but understand why they're doing them.
Okay, I'm definitely seeing the importance of CNAs in a new light. But before we get into specifics,
Sure.
I'm curious, what about timekeeping? I know there's something about military time that always trips me up.
Yes, military time. Might seem intimidating at first,
Yeah.
but it's actually a really logical system designed to avoid confusion.
Yeah?
And in healthcare, clarity is key.
Yeah, of course.
Every minute matters.
Yeah. Okay, so break it down for me. What's the logic behind military time, and why is it so important in healthcare?
Well, think about it. In a hospital, things are happening all the time, 24/7.
Yeah,
Medications need to be given at very specific times.
right.
Procedures are scheduled. Patient records are constantly being updated.
Oh, yeah, so using a system where like 2.0 could be AM or PM, that would be a disaster.
Exactly. Military time gets rid of that confusion by using a 24-hour clock.
Okay.
So instead of 2.0 AM or PM, you'd say 0200 or 1400. No more room for mistakes.
Gotcha. Okay, that makes a lot more sense. But how do you actually convert standard time to military time? Is there a trick to it?
It's pretty easy, actually. For
Yeah.
times after 1:00 p.m., just add 12 to the hour.
Oh,
So 2:00 p.m. becomes 1400, 3:00 p.m. becomes 1500, and so on.
I see. So if we were to document the time of this recording in military time, it would be 1500 hours.
Exactly.
Makes me feel very official. But I imagine it takes some practice to get used to using both.
You're right, it does. But CNAs are trained to switch back and forth, making sure all the documentation is clear and accurate.
They're like time translating ninjas.
I like that.
Okay, so we've talked about the why behind these measurements and how important accurate timekeeping is. I'm ready to dive into the how, like the actual procedures CNAs are trained on.
Okay, let's start with something simple, like measuring weight on a standing scale.
All right, that sounds easy enough. Just step on and read the number, right?
Well, there's a bit more to it than that.
Oh, okay.
First things first, before the patient even gets there, make sure the scale is balanced at 0.
Of course. Don't want to start them off on the wrong foot, literally.
Right. Okay, so scale's balanced, patient steps on.
Hmm.
What's next?
Good question.
Got to make sure they're standing right, no leaning, holding on to anything,
Right.
no shifting their weight. We need a solid reading.
It's like a delicate dance to get that perfect measurement.
Exactly. Then you read the scale, make sure it's to the nearest quarter pound or tenth of a kilogram, depending on which system you're using. And of course, record it in the patient's chart.
Right, with the right units. Okay, so standing scales seem pretty straightforward.
Yeah.
But what about those specialized scales we talked about before for patients who can't stand on their own?
Oh, those have a whole other set of procedures. Like the wheelchair scale. Remember we talked about weighing the empty chair first?
Yeah, that was a neat trick to keep things accurate.
It's more than just a trick. It's crucial to make sure you're only measuring the patient,
Right,
not the chair. You'd be surprised how much those things can weigh.
I bet. So you weigh the chair, then help the patient in, weigh them together, then subtract the chair's weight.
Yep. Multi-step process, but it keeps things accurate and safe.
Makes sense. What about measuring height? Is that as simple as grabbing a measuring tape?
Sometimes, yeah. If they can stand up straight, we can use a standing scale with a measuring rod.
Okay.
It's got both inches and centimeters, so we're good either way.
Ah, so we're still juggling both systems even for height.
Yep. But if they can't stand, things get more interesting.
Ooh, okay, now I'm really intrigued. What do you do if someone can't stand up straight to be measured?
Well, for someone who's stooped or has contractures, we might measure them in segments with the tape measure and then add those together to get their total height. It's all about adapting to their needs
Right.
and getting that accurate measurement.
Wow, that sounds like it takes a lot of precision.
It does. And for patients who can't get out of bed at all, we even have a way to measure their height right there in the bed.
Wait, measuring height while they're lying down? I'm picturing some crazy system of strings and protractors.
It's not that complicated. We just make marks on the sheet where the top of their head and the bottom of their heels are
Okay.
and measure the distance between those marks. It's surprisingly accurate.
Wow, that's pretty ingenious. I'm really impressed by all the problem solving that goes into these procedures. It seems like CNAs are always thinking on their feet to get the job done right.
Exactly. They're masters of adaptation and precision. And that brings us to another essential skill, measuring volume.
Okay, I'm ready for the world of graduated cylinders and measuring cups. This is where those conversions between ounces and milliliters come in, right?
Absolutely. Measuring volume is super important, especially when it comes to keeping track of fluid intake and output.
Right.
We use those graduated cylinders and measuring cups to get accurate measurements of liquids, and we record them in both metric and household units.
So it's not just about pouring a glass of water, it's about precisely measuring every milliliter or ounce.
Exactly. And it goes beyond just drinks, too. We measure things like urine output,
Oh.
which helps us keep an eye on how the kidneys are doing.
Wow, I'm really starting to see how all these measurements come together to give a full picture of a patient's condition.
You got it. And that's why these seemingly simple skills are so important. They're the foundation of so much in healthcare.
It's crazy how much depends on these, basic skills. I honestly thought this deep dive would be all about memorizing stuff and following the rules. But it's way more than that.
Right.
It's about thinking critically, figuring things out,
Yeah,
and realizing that these measurements can really make a difference in how someone's cared for.
absolutely. It's about connecting the dots,
Yeah.
understanding the why behind the how.
Okay, before we wrap things up,
Sure.
I want to go back to that question you asked earlier
Okay.
about everyone using the metric system. What would that even look like? What kind of impact would it have?
Well, practically speaking, It would make things a lot easier.
I bet.
No more converting between ounces and milliliters, pounds and kilograms.
Right.
Think about how easy communication and collaboration would be, especially in science and medicine.
Oh, yeah, that would be huge, especially in a world where we're all working together across different countries.
Exactly. A universal system would simplify everything.
Wow.
Trade, science, healthcare.
But let's be real, wouldn't there be some pushback? I mean, people get pretty attached to their ounces and inches.
You're not wrong. It'd be a huge cultural shift.
Yeah.
And change is tough.
Yeah.
People are creatures of habit.
Oh.
There would definitely be some resistance.
Makes you wonder if it would really be worth it. Would all that efficiency be enough to overcome those cultural hurdles?
That's the big question. It really makes you think about how logic, culture, and human behavior all play into something as simple as measurement.
Right.
It shows how complex things really are.
It's wild to think that something as objective as measurement is tied to our own perceptions and experiences.
Exactly. And it shows how adaptable CNAs are.
Yeah.
They're already dealing with two different systems.
Right.
And switching between them to make sure patients are getting the best possible care.
Well said. They're the unsung heroes of measurement, making sure everything's accounted for.
To our listeners, we hope this deep dive has given you a new perspective on weights, measures, and timekeeping in healthcare.
Yeah.
They may not be glamorous. Right.
But they're absolutely crucial to patient well-being and how smoothly the whole system runs.
It's been an amazing journey, discovering all the hidden complexities of these essential skills. It's made me realize that sometimes the most basic things are the most important.
Absolutely.
So next time you see a CNA carefully measuring medication or taking a patient's weight, remember they're playing a huge role in providing accurate, safe, and effective care.
Couldn't have said it better myself.
They're the guardians of precision, the champions of consistency, the unsung heroes of healthcare. Thanks for joining us on this deep dive.